Hello, my name is Jimena Lozano, and today I will be presenting my ILO initiative called Respira Monterrey. The presentation is in Spanish, but I will be presenting in English. And so, to begin, our central question is how much does it cost Monterrey to breathe polluted air? In this project, we focused it as a prospective research initiative that analyzes the impact that cleaner air could have on the health, productivity, and quality of life of people living in the Monterrey metropolitan area by the year 2040. So, we chose this topic because air pollution is not only an environmental issue, as we know, it is also a public health issue, an economic issue, and a social justice issue. Every day, thousands of people in Monterrey are exposed to poor air quality, but not everyone experiences the effects the same way. Of course, there are different children, older adults, or people with chronic diseases, like outdoor workers or low income communities as well, that are usually the most vulnerable. So, through this project, we want to translate scientific and technical information into accessible evidence that citizens, organizations, and public decision makers can understand and use for future decisions. Let's talk about Nuevo León today, because to understand the necessity behind this project, we have to first look at the current situation in Nuevo León. So, the evidence that we researched shows us that air pollution in the region is strongly connected to industrial emissions, mobility, urban growth, and specific pollution sources, such as the refinería in Cadereyta. According to the information we reviewed, a significant percentage of PM 2.5 and PM 10 particles molecules concentrations are associated with emissions from this refinery. So, this matters because these particles are not just numbers on an environmental report, they enter the respiratory system and can affect people's health over time. The literature also links air pollution with respiratory and cardiovascular diseases, higher mortality, and premature deaths. So, for us, this evidence helped us recognize that the problem is quite urgent, and this is something that is not new. We know that Monterrey's air quality affects the way people live, move, work, study, and take care of their overall health. It is a collective issue, but it has very personal consequences. So, what is the challenge that Monterrey faces? We identified three main dimensions in this challenge: a health dimension, economical dimension, and social quality of life. So, first, in terms of health, pollution is related to respiratory diseases, cardiovascular diseases, hospitalizations, and higher risks for children and older adults. So, this means that polluted air can directly affect the people's dignity because it limits their ability to live safely and healthily in their own city. So, second, there is an economic impact. When people get sick, families spend more on medical care. So, workers may miss work due to illness, and even when they attend, their productivity can decrease because of symptoms like fatigue, coughing, or difficulty breathing and concentrating. And third, there is also a social impact. The poor air quality limits outdoor activities, which are so very important. They also reduce well being, and it creates generally a negative perception of the city. So, for example, families may avoid the parks, or students may have fewer outdoor activities, and people may feel that living in Monterrey means accepting this air pollution as normal. So, where our project starts from, is from the idea that this should not be normal. So, we all deserve to breathe clean air because it is connected to health, dignity, and the right to a quality of better life. Our central research question is: what impact would a significant reduction of atmospheric pollutants in Monterrey have on the health, productivity, and quality of life of its inhabitants by 2040? So, the objective of our ILO Respira Monterrey is to analyze and communicate in an accessible way four main elements: the impact of pollution on public health, the economic losses associated with pollution, the effect on quality of life, and the potential benefits of reducing pollutants towards 2040. So, we aim this initiative to be entrepreneurial because we are not only collecting information, we believe that we are creating a bridge between technical evidence and social action. Our value proposition is to transform complex data into visual reports, executive summaries, and communication materials that can help citizens and organizations understand the real cost of pollution. In other words, we want to make the invisible visible. Air pollution is often hard to understand because it is measured in technical indicators, but our goal is to show how those indicators translate into health risks, economic costs, and daily life consequences. With all of this, we formulated our hypothesis. So, our hypothesis is that if Monterrey achieves a significant reduction in atmospheric pollutants by the year 2040, we would expect to see four positive effects. First, a measurable decrease in diseases associated with chronic exposure to the PM 2.5 particles and ozone, especially among the vulnerable groups such as children and older adults. Second, a reduction in productivity losses caused by people being absent or presentism related to respiratory illnesses. So, this means that fewer people are missing work or performing below their full capacity because of pollution related health issues. Third, we have an improvement in urban well being indicators such as more outdoor activity and a better perception of quality life amongst the people living in Monterrey. And fourth, a progressive decrease in the economic burden on the health system caused by diseases attributable to poor air quality. So, our hypothesis connects directly with conscious entrepreneurship because we are evaluating impact not only from the economic perspective, but also from the social, environmental, and ethical perspectives. So, what's our research method? We combine applied research with prospective analysis using scenarios from 2025 to 2040. So, our first step is observing the environmental problem. So, this includes understanding how people experience pollution in their daily lives and identifying the communities who are most affected by it. The second step is reviewing official data and scientific literature. So we are considering public databases, academic sources, environmental indicators, and reports from organizations that study the urban quality of life here in Monterrey. The third step is analyzing the social and economic impact. So this means connecting pollution data with health outcomes, productivity losses, medical expenses, and well-being indicators. And finally, the fourth step is comparing scenarios. So, for example, we can compare a scenario where pollution continues at the current levels it is right now with another scenario where Monterrey significantly reduces its pollutants concentrations by the year 2040. So, this approach allows us to move from a general problem to a concrete impact assessment. And it also helps us communicate not only what is happening today, but what could happen in the future if action is or is not taken. Next are our study variables. The variables of our study are organized into three categories: health, economy, and quality of life. In health, we are looking at respiratory diseases and mortality associated with pollution. These variables are important because they show the direct human impact of poor air quality. In economy, we are considering absenteeism, productivity, and medical expenses. These variables help us estimate the economic cost of pollution for families, companies, and the public health system overall. And in quality of life, we are considering perceived well being, outdoor activity, and urban conditions. This is important because pollution does not only affect people when they go to the hospital, it also affects their daily decisions, such as whether people can exercise outside, take their children to the park, or feel safe living in their city. So, by combining both quantitative and qualitative variables, our project recognizes that not every impact can be captured with only one type of data. Numbers help us measure the size of the problem, but qualitative information helps us understand how people really experience it. Who are our allies and stakeholders? So, for this project, stakeholders we know that are essential because air pollution affects so many groups in many different ways. So, our current ally in connection is Como Vamos Nuevo León. We are currently in communication with them to understand how our research could contribute as an input for their analysis of urban indicators and quality of life. We also consider Si Se Puede Nuevo León as a potential ally for diffusion and community outreach. Their role could be important because our project needs to reach not only experts but also citizens and communities. Another potential stakeholder is the municipal government of Monterrey, especially through areas connected to transparency and public information. We are considering delivering the final report to those institutional actors so the information can support evidence based decision making. And of course, we have other stakeholders, which include citizens, vulnerable communities, healthcare institutions, schools, companies, civil society organization, and policymakers. The ethical foundation of Respira Monterrey is based on transparency, environmental justice, access to information, and respect for vulnerable communities. This project connects mainly with three SDGs. First, we have the SDG number three, which is good health and well being, because air pollution directly affects respiratory and cardiovascular health. Second, we have SDG number 11, which is sustainable cities and communities, because Monterrey's urban development has to consider the right to a healthy and livable city. And third, we have SDG number 13, which is climate action, because reducing pollution is also connected to a broader environmental responsibility and sustainable urban planning. Our ethical approach is to communicate information clearly, avoid exaggerating claims, and recognize the limitations of our research. We don't want to create fear, we want to create an informed awareness. And we also want to avoid blaming individuals for a systemic problem. Air pollution is produced by multiple sources and requires coordinated action from the government, industry, citizens, and civil society. Now let's talk about our expected impact. It is defined using SMART criteria, so it is specific, measurable, achievable, relevant, and time based. We think it is specific because we aim to generate and disseminate evidence about the impact of reducing atmospheric pollutants on health, productivity, and quality of life in Monterrey. It is measurable because we expect to produce a prospective research report for the period from 2025 to 2040, at least three communication products, and diffusion with civil organizations and institutional actors. We think it is achievable because the project is based on public data, existing scientific literature, and collaboration with citizen organizations. It does not require complex technological infrastructure to begin. And it is relevant because it translates complex information into accessible evidence, helps visualize the real cost of pollution, and supports evidence based decisions. Finally, it is time based because our report is planned for August of 2026, with diffusion immediately after the final delivery. So, the positive impact we expect is not only academic. We want this project to become a useful input for conversations about public health, environmental justice, and overall urban decision making in the zona metropolitana of Monterrey. So, with all this, what are we finally doing now? We currently are in the research and evidence building phase, or what we would call the pre analysis stage, with the goal of delivering our final project in August of 2026. At this stage, we are reviewing scientific literature, we are collecting still public data, organizing the variables, and strengthening the structure of our prospective analysis. We are also in contact with Como Vamos Nuevo León, who can provide us guidance and key information to strengthen our research. So, our next steps would be to deepen our data analysis, define the scenarios for 2040, estimate the potential impacts, and transform the results into a clear communication material for citizens and stakeholders to understand. So, to conclude, Respira Monterrey is more than a research project. We want it to be an initiative that seeks to connect evidence, empathy, and action. And it helps us ask the important question, what kind of city do we want to breathe in? So, by evaluating all the social, economic, and environmental and ethical dimensions of air pollution, we hope to contribute to a more informed, healthier, and more sustainable Monterrey. Thank you.